Good evening and welcome to In Our Community. Today we're going to be talking with Bill Lindemann, who is an active Parkinson's disease patient. I think he has a lot of courage, and tonight we're going to be talking about his experience with Parkinson's, the definition of Parkinson's, which I'll read shortly from the Parkinson's Disease Foundation, his travel in time from prior to where he is today in his process, and the journey that he's taken and how he's gotten there. I hope you enjoy this process because it's a very active disease state in today's world. And I'm going to start by setting the stage by just reading the Parkinson's Disease Foundation definition, which starts, Parkinson's disease is a chronic and progressive movement disorder, meaning that symptoms continue and worsen over time. Nearly 1 million people in the U.S. are living with Parkinson's disease, but the cause is unknown. And presently there is no cure. There are treatment options such as medication and surgery to manage its symptoms. Parkinson's involves the malfunction and death of vital nerve cells in the brain called neurons. Parkinson's primarily affects neurons in an area of the brain called the substantia nigra. Some of these dying neurons produce dopamine. Dopamine is a chemical that sends messages to the part of the brain that controls movement and coordination. As Parkinson progresses, the amount of dopamine produced in the brain decreases, leaving a person unable to control movement normally. So some of the symptoms or side effects of this dopamine lacking are tremors of the hands, arms, legs, jaw, and face, bradykinesia, or slowness of movement, rigidity or stiffness of the limbs and trunk, and postural instability or impairment balance and coordination. And I think it's going to be interesting tonight to have Bill share with us his experiences in his life. And so, Bill, welcome to In Our Community. And
thank you, Bart.
I'm very interested in your story, and I think you're very courageous to share this because, as I just pointed out, there are millions that are having to deal with this type of disease state today. So we've talked about a little bit of the definition of Parkinson's, and I'd like to just jump into your story. And why don't you begin by sharing with us when you first had symptoms, what was your age, what was your activity level, what was your industry, just your life?
I was in my early 40s. I was working as a computer programmer full-time, and I used to like to lie down on the sofa with one arm extended under my head and read a paperback book held like this. I started noticing that the hand at the end of the left arm, when it was held out, that's kind of a position the muscles are tensed in, and it started shaking a little bit. And I thought, oh, well, that's just too much coffee, or maybe this position is hard on my muscles, leaning against the drop of my head on the nerves. But I eventually got it checked out by a doctor, by my primary doctor, and she referred me to a neurologist, and he concluded that it was Parkinson's, and he treated me for a couple of years and then referred me to the Parkinson's Institute in Sunnyvale, which we have here, which is an amazing resource.
So when you were first diagnosed, were you surprised? Was this a shock to you that you had Parkinson's disease?
Yeah, although I don't remember having I didn't like it, I didn't have to sit down and hold my head in my hands as the world spun around me or something. I just said, oh, okay. Well, I knew that something was developing there. And at the time, I didn't fully appreciate all that Parkinson's would involve.
Ah, so you weren't aware of the Parkinson's disease state as you obviously are now.
Yes.
So your first doctor sent you to a specialist, and then you got into an institute?
Yes.
Well, this is lucky there was one close by.
Yeah, Parkinson's Institute does research and education and patient treatment. At the time, they had 4 Parkinson's trained neurologists specialized in doing only Parkinson's. Like, that was what my first neurologist said was, it had gotten to the stage where he no longer felt that he could give me the best treatment because the people at Parkinson's Institute did nothing but Parkinson's all day, whereas he did a lot of other neurological conditions.
So that's it. Well, it was definitely their specialty.
Yeah.
Yeah. So at what age? Did you mention the age when you were first diagnosed?
Sometime in my early 40s. I haven't gone back and pinned down the year.
Okay. And what was the primary method of medications that you started on?
I started on something called Mirapex, I believe, and then also they tried Requip, which some people may recognize as something that's given for restless leg syndrome. Doctors often say that when they see it on my list of medications. They don't realize that it's a Parkinson's med.
Sure.
And these did some good. Eventually, when I moved to the Parkinson's Institute, they started me on the gold standard, which is called Sinemet, which is L-DOPA plus carbidopa. L-DOPA being the levodopa, the neurotransmitter
that relates to the definition I spoke of earlier, where it affects the release of dopamine, right?
Right.
So that's probably tries to supplement that dopamine.
Yeah, that's oral medication that supplements the dopamine.
Mm-hmm.
And then there are a lot of other drugs that are given along with that were added along the way, like Comtan, which is an enzyme that breaks down, keeps the dopamine from being broken down in the synapses between the neurons.
So it increases the effectiveness of the dopamine, causing a higher level.
Yeah.
So that it isn't washed out of the body. Is that kind of what you're saying?
Right. So on the one hand, you're putting some in with the Sinemet. On the other hand, you're taking Comtan, and there are various other chemicals. The Mirapex is one, I think works a little bit differently than Comtan, but all of them basically boost the levels by making sure that it either isn't reabsorbed by the neurons quite as quickly or broken down and destroyed.
Mm-hmm. Very good. So how many years were you on the Sinemet?
I'm still on it, basically since I was first started on it in, I guess, my mid-40s.
And so as you tried these different drugs along the way, from your experience, did you have side effects? How did the side effects affect your life? You went probably from not having tremors to being on medication. Tell me a little bit about that part of this experience for you.
The side effects when I became focused on awareness of them were more later on when I was getting higher doses of medication. There are things called dyskinesias. I tend to get it as facial twitching, facial muscle twitching, what my doctor calls technically hemifacial spasms, basically like this.
I see.
Side of my face would scrunch up.
Uh-huh.
And my current doctor, believe it or not, Botox is a treatment for that.
Oh, you give injections of Botox?
Yeah.
Well, you're in with all the beautiful stars.
Yes. Well, unfortunately, it's not aimed for beauty. It's aimed for
exactly.
the muscles around the eyes that cause the squinting.
So the Botox, if it were to be used, it would be eliminating the spasm in the muscle.
Yeah, by deadening the muscle temporarily.
Right.
Lasts for like 3 to 6 months.
And then another injection.
Right.
Right. So how long you were on the Sinemet, and then how was the disease progressing in your 40s?
Well, it was getting worse and worse. I was getting persistent tremor, whether standing and walking or sitting, especially sitting and trying to use the computer. It got to where my hand would shake like this when I tried to type on the computer, so I obviously couldn't type normally. I got to where I basically took 4 fingers and braced them on the top of the keyboard and pivoted my thumb around the individual keys to type them, so it got rather slow to type. And I was also getting more of the dyskinesias from the medication because the dosage was being increasing.
At that time, did you use aids to assist you in walking? Did you have to, or?
Let's see, then. I did not. I guess I started using a cane somewhere during that period. I can't remember exactly when. I was definitely using one when I went in for surgery, which is, I think, the big thing we want to discuss here, because that's what made a big change in the treatment of my condition.
So surgery, maybe to most of the population, may not understand that there's a surgical procedure that can take these tremors down to a normal rate, or close to a normal rate, we hope. And that is a surgical procedure that does what? Why don't you explain what that actually is?
Well, the technical mouthful is DBS implant, stands for Deep Brain Stimulation Implant. Deep brain means they stimulate down in the back near the basal ganglia, several inches down from the top of the brain, near the where it merges into the spine, spinal column.
So the surgery has to do with opening up the skull and the matter and inserting these
Fine
electrodes.
wires, electrodes, yes.
And the electrodes come down and are attached to what?
Attached to a stimulator unit, which is right here. And can we have graphic 1?
So Bill has brought along some pictures that will show here, and there we go.
Yeah,
and
that's the thing that's implanted in my chest up here.
The one on the box-like item on the left?
Yeah, the silver box with the plastic top on it. That whole thing, including the top, which is basically places electrodes to plug in, it's there next to a Safeway Club card, a regular size credit card for size comparison. And there's a sample of one of the wires. They're iridium platinum wire conductors, so they remain inert in the body. No idea of how much that wire costs per foot, but it's probably quite a bit.
I would imagine. So how did you learn about this procedure, implanting these electrodes? Did you have or know anyone of your friends that may have Parkinson's that had done this procedure?
Yeah, I had a friend from college who I kept in contact with who was about a year younger than I, but diagnosed with Parkinson's 7 to 10 years earlier than I was. So he was diagnosed really early. And he got the implant done in 2002. I got mine in 2011. So he was way ahead of me on this, and it seemed to work pretty well for him. And I'd also read about it in the popular press.
So did he use the same device that you used, 2001 or so versus 2012?
It was an earlier model. Those devices, basically, you could just turn on or off, turn them off if the stimulation was somehow making the things worse instead of better by waving a magnet over them in a specific place. This here is put basically where they put heart defibrillators or heart pacemakers.
So it's not a pacemaker or anything like that. This device basically stimulates the electrons that are specifically placed in locations in the brain.
Yeah, and I should say basically the crux of the operation is they drill 2 holes in my head up here, one at a time, and put sample wire, antenna wire down to find the area that they want. They listen to the nerves firing by listening to clicks on an audio speaker on the wall of the operating room. It sounded like a lot of static going on.
But you're conscious during this period?
Yes, you have to be conscious because they want to see how the brain is functioning.
But you didn't have pain, or you did?
No, no.
No pain involved?
No pain.
Isn't that
Well, the brain itself doesn't feel pain, and they did put a stereotactic framer on my head, which has, screws that screw in at these 4 points to point at things to contact the skull so that it doesn't move. But they squirted lots and lots of lidocaine and local anesthetic in there before they did that, so I didn't feel a thing.
So you didn't feel too much?
No, and then they used sedative as well, so...
Slightly sedate you, but you were alert. Did you have to have responses that they'd ask you, and you have to answer the questions or whatever?
Yeah, they did a couple of things. They did a mental status check to look for if they had accidentally perhaps caused some bleeding that they hadn't seen yet, or just make sure that they weren't touching anything that was adversely affecting the brain. They'd have me repeat sentences with a lot of S's in them, like "it's a sunny day in San Francisco," and see if I slurred them. And that came up again later because when they're placing the electrodes, they want to make sure that they're in an area that controls muscles. So basically, when they find an area that has the right kind of discharges, generally a loud area followed by a quiet area. In the quiet area, then they come and they move my elbow or hand or leg, and make sure that the firing rate of the neurons increased. And they know that they were in a motor control area.
Interesting. So then they would map you out, so to speak?
To a small extent, yeah. They know about where they're going.
But we're all individuals, so we're all not exactly the same, right?
Yeah.
Yeah, so that's what they're trying to find, exactly where, for you, this trigger is.
Yeah.
Yeah. So how many hours was the surgery?
About 7 to 8.
And by the time, 7 or 8 hours is a long time. So by the time it was done, did they close you up and you were all set and wired, ready to go, and it was firing?
Well, in fact, no. They don't activate the box. It's got a battery and a computer and everything in it, and it responds to external controls. We'll talk about that in a minute. But Oh, in fact, they kept me awake only for the part where they had to get my responses to where the electrodes were to place them. Then they gave me a nice big shot of propofol and put me under, because the rest of it involved threading these wires down through here. There's extension wires on it that go down here and then plug into the thing down here. And they say that would be rather unpleasant if you weren't fully sedated.
Oh, I would imagine, but you're truly a bionic guy, that's for sure.
Yeah. So if we can have slide number 2,
yeah,
we'll take a look at the wires. And the wires, as I said, are platinum iridium. There you see the 4 contact points. There's 2 wires there. I think one of them is actually the end that goes in the brain, and the other is the end that goes in the intermediate connector that goes to the extension wires that go down to the unit in the shoulder.
So we're looking at this on the screen, and I see 1, 2, 3, 4 silver ends. Are those 4 different electrodes, or is that just 2 electrodes with 4 different silver parts to them?
That's 4 contact points on each electrode in each side of the brain. And
I see.
The control unit here can control them independently. It can change the relative polarity between them. It can change the voltage across them, all the electrical parameters.
So now you're sit up, you have the electrodes in, you're back recuperating from the surgery in your room in the hospital.
And let's get slide number 3 up where we talk about this.
And share with us what they activate. So there's your incision.
That's the incision. They went across the skull because they needed to get to the brain on both sides. And they drill holes in there, and then they put the electrodes in, and then when they got in position, they carefully back out the cannula that they used to guide them, and they put they screw down, actually they already have screwed down when they went through the holes, a little plastic frame there, and with titanium screws, and then they have a little round cap that goes on top of it. The wire loops under for strain relief, so in case anything pulls here, you get nicked. I mean, you get in an accident or something, and something pulls on the wires, they won't just pull out of the brain.
So that's permanent to hold the electrode in place, in other words. So if there's any tension on it from whatever kind of movement you have to do in life, it's going to not move that electrode.
Right.
Right. So tell us now, how long did it take to recover? When did they activate? You said they didn't activate it right away, but walk us through that steps and how your first steps were, and then I have a bunch of other questions for you. Oh,
well, they went back a week later, and they took out the staples and activated the unit. The picture of my post-surgical thing was they used staples rather than sutures, which turned out to be pretty effective. I got
staples.
Very small amount of scarring.
Well, in your appearance to me, I don't even see any scar. I'm sure if I looked really close, I'd probably see something, but yeah, it doesn't appear as though there's any scarring at all.
Yeah, so, they did real well.
Yeah, that's wonderful.
So then they turn it on, and the nurse, who has been trained technically in how to work it, spends about an hour to an hour and a half determining maximum voltage and stimulation. There's a rep rate, there's a pulse width for those who are technical in the audience, and voltage. And she would ramp those up until I started basically, she had me do the same sentence, it's a sunny day in San Francisco. And I would get to the point where doing, it's a sunny day in San Francisco. And then she'd know to back off and mark that as too high a voltage.
So, are you on medicine at this time also?
Yes.
Okay,
yes.
so they didn't stop the medicine?
No, the medicine reduces by a factor of about 1/2 to 2/3 after surgery, but you still need some of it.
Okay. So the medication, that's interesting. The medication is continued. The electrodes are used to dampen the tremors and side effects of the disease, in other words.
Mm-hmm.
Okay. So when did they activate it?
As I say, about a week later when they took the stitches out.
And did you stay in the hospital for a period and did you do physical therapy, or did they just activate it and send you home? Walk us through that part.
Okay, basically I went in for surgery at 7 on a Wednesday morning and was discharged from the hospital at about 1 o'clock the following Friday afternoon. So it was only a 2-night stay in the hospital.
To place the electrodes?
Well, yeah, to place the electrodes.
Okay.
And then I came back as an outpatient a week later when they turned on the device. And initially they programmed it with some general parameters, and if we could have slide number 4, they gave me a device where I could control, this is the device, it's called the patient access unit, and I can control things like the voltage, The letter C in there on the lower line on the display is basically, we have A, B, C, and D parameters now with my current doctor, and I can set it for different stimulus levels that sometimes seem to work better for sitting and working on the computer versus walking. Different combinations work better. It'll also tell the battery condition, which is more about that in a minute. So that the doctor has a much more elaborate version of this with a much bigger display, where he can set the ranges and what basic sets of parameters he gives you for simulation and so forth. Well, things on the left side of the screen is the antenna that hangs on a cord over the shoulder. It hangs right over top of the unit, and that's how it communicates from the outside to set what's going on in the unit inside the body.
So you have a battery, right? You were telling us that it's battery oriented versus the older model that was magnet oriented?
Well, no, this is the magnets were just a primitive way to turn it on and off from the outside.
Oh, that related to what we just saw in the control box then.
Yeah, the control box you saw there is a more sophisticated version that they do now.
I see.
Where you get full control, you can query it. The battery is significant because they normally implant one with a permanent lithium battery that's supposed to last 3 years, and then you surgically swap out for a new unit. But mine started running down after 18 months. No one was able to explain why. So my doctor recommended a rechargeable unit, which I have to wear a recharger and a vest around my chest, and has a big round hockey puck sized thing that sits over the unit here with wire coming out of it.
So that's what you currently use? Yeah,
and it transmits power, and I have to charge it every day or two.
And is there any, I know on my phone, if I let it go too long, which I always do, it gives me a notice. Does it give you a notice?
Yes, actually, the implant unit itself can't really give you a notice because there's not, you can't hear it buzz from inside the body. But what they do is they take the control unit that we looked at, and it once it recognizes that you now have a rechargeable, it beeps every morning to remind you to use it to check the voltage.
And so how do you manage your battery? You just charge it for a half an hour every day? Is that kind of what you do?
That's the habit I'm trying to get into. I used to let it go sometimes until it was down to a quarter or so. Okay. If you let it go too far, and I'm not even sure I know how to recognize the indication that it gives if it goes too far, it will actually shut itself off to preserve the battery life, or shut off the stimulation to the brain and keep only enough power to keep the electronics going so it can talk to the outside world and get what's called a trickle charge, which apparently you have to go to the doctor's office and they have a special charger for.
I see.
So if you do that more than twice, I think the unit has to be replaced surgically.
So let's talk now about lifestyle. Where your tremors were before the surgery, you kept doing the medication. What was your lifestyle like, and the difference after the surgery?
After the surgery, I could get around a whole lot better. My walking had deteriorated to where I get this stuck to the floor kind of stance, where basically I hesitantly take one step and then another step. The morning of the surgery, for instance, when I had to not have taken my medication for 12 hours beforehand, I was just barely able to walk to a taxi to get to the hospital.
Wow.
And had a friend accompany me. And then immediately after the operation, actually, the symptoms got better, not because the unit was on, but because apparently the trauma to the brain tissue as they install it caused some certain small amounts of swelling, and that actually improves the Parkinson's symptoms temporarily.
Yeah, that's interesting.
Not recommended as a permanent procedure, but...
Not at all, I'm sure. So your mobility was increased.
Yes.
And I noticed you have a cane.
Yes.
When did you start using a cane?
Sometime a few years before the operation. I don't really recall.
And that was for just balance?
Balance, yeah. And also just to give me a third point of reference if I'm trying to get my foot stuck from under me. We call this being glued to the floor in Parkinson's.
Okay. And that glued to the floor helped a little bit or a lot after the procedure?
Yeah, it's gotten better.
So tell me now a little bit about your physical activity. Your lifestyle, do you do exercises? Are you active? Tell me a little bit about your weight. Have you been heavier than you are today? How did that impact your disease state? Things of that nature.
Over the few years, as my symptoms got worse and worse and my walking got more constricted, I became less and less active. I used to walk maybe 3/4 of a mile or half mile in each direction on Sundays with a friend to go get brunch. And I no longer was able to do that. And I tried bicycling a few months before, I tried it again rather, I hadn't bicycled for a while, a few months before the operation, and found that my balance on the bike had deteriorated to the point where I was uncomfortable turning the bike. I felt like I'd fall over if I leaned over into a turn. So that improved dramatically. I was able to bicycle pretty easily. And now, after the operation, I was able to, and still am able to, type normally on a computer keyboard.
Oh, that's
2 hands.
fabulous. So you got those functions back.
Yeah.
And today you can ride a bike in your community, downtown or wherever you want to go?
Yeah, I live out in a mobile home park, so it has kind of roads that don't have a lot of traffic on them.
So that's good. So you can choose your spots and you can put your foot down if you come to a stop sign and balance yourself and start up again.
Yeah.
Oh, that's great. So tell me a little bit now, we have about a minute or two left, a little bit about what you look to the future for from a lifestyle, what you have been told about end-stage Parkinson's, and anything about upcoming IT help and how it might help your life.
Well, they say that Parkinson's is always degenerative, but the degeneration is slowed. They don't know actually to what extent by the surgery. But definitely I've kept most of the gains I made through the surgery. In fact, to some extent I'm getting additional gains because I did allow myself to gain a fair amount of weight. I was up to 360 pounds. Got on a diet last year, medically supervised. It works really well. It got me down to 290 where I am now, and I'm going even lower.
Well, that's great. That was called a special HMR program?
HMR is the company that packages the diet, and they provide it through medical offices. I get it through the local medical clinic because it's medically supervised.
Wow, that's fabulous. And we have maybe 30 seconds left, so probably our viewers might be interested in how you're dealing with the end stage. Just a real short comment about that.
Well, I'm trying to maintain as much mobility as I can. We were talking before the show, and I pointed out that technology seems to be heading in the direction of helping people who are more and more homebound. I mean, without cell phones, I would never dream of going out driving at night, even with the way the symptoms are now.
That's great. Well, I've been given the signal to say we're wrapping up. So, in our community, it's Bart Nelson and Bill Lindemann, who is courageously here to talk and share his experience with Parkinson's. Thank you, Bill.
You're welcome. Thank you for having me.
You bet.